And thanks for joining us this afternoon. I'm Lisa Kleinbub, Executive Director of Regional Center of the East Bay. And I want to also introduce Steve Robinson, who is our Director of Community Services at Regional Center of the East Bay, who will be answering some questions today about the topic of alternative service delivery. And we have interpretation today in Spanish, if that's what you need. So I'm going to start by sharing my PowerPoint and providing you some information on what's being called alternative service delivery models. And it's something we're all going to be talking about a lot as we move into the next months. And let me get started with the sharing of the PowerPoint so we can all be looking at the same things. Okay, hopefully people can see this now. I wanted to talk about alternative service delivery and what does it mean for our community. I'm first going to start with a little bit of a COVID update, since the reason that we are talking about alternative service delivery is because of COVID-19. And right now, Regional Center of the East Bay, our population is about 21,388 individuals. And to date, we know of 72 individuals that we serve who've tested positive with COVID-19, and there have been 2 people who've died from COVID-19. Above that, we have the information about the total regional center population and cases across the state. We were seeing a real rise in cases 2 or 3 weeks ago. That seems to have stabilized, and the number of cases is not increasing as dramatically at this point. And right now, in the counties that comprise Regional Center of the East Bay, there are COVID-related restrictions, and those remain in place. Where both counties are under shelter in place. The messages of wearing masks and face coverings, hand washing, physical distancing are in place, and we remain on the county watch list. And that means the real changes in shelter in place won't occur until the cases have declined to the point that the county is off the watch list. And while both counties have stabilization of case rates, there aren't really significant declines, and the percentages of people testing positive for COVID for our populations is still high, and it will be a 2-week average of that will lead to us being able to get off the county watch list. Until we are off the county watch list, we will not see school reopenings, and we will not see further reopenings of other public amenities. So the alternative delivery of non-residential services is proposed and will be implemented by the Department of Developmental Services starting September 1st, which is next Tuesday. Prior to this, the COVID response from the Department of Developmental Services included waivers of various statutory and regulatory requirements during the state of emergency. And DDS authorized payments for consumer absences in non-residential services. And there was an introduction of flexible models for services, including remote services. And the thing that is mostly changing September 1st is the payment for absences in non-residential services. And you can see from this graph, this chart here, that we had absence payments from March 20th through August, and that will change September 20 going forward. And we don't know when that will end because we don't know when we'll be able to return to some semblance of our past practices and behaviors. Why is there a change? Why aren't we continuing with absence billings? Well, for one, the Centers for Medicare and Medicaid Services, CMS, has clarified that they would only pay for those absences through June 15th. And so it is important for the state to have secure federal funding, because over 50% of the funding to our system, and depends on what population we're talking about, when the state spends $1 for over 50% of our expenditures, we get 50 cents from the federal government back to the state for those expenditures. So it really does help with being able to fund services. There's also been a real interest to offer more flexibility, to tailor different services to meet people where they are, and to ensure that services are flexible and aligned with consumer preferences and their IPPs. And we wanted to increase the opportunities for consumers to guide service providers to creatively respond to their individual needs and preferences. And we want to build in the next months on innovative service delivery approaches that have been going on since March, while continuing to limit exposure to COVID-19. And this also establishes a mechanism for providers of services who are providing services to receive payment, and also to preserve the workforce and basically the structure that we've had in place. So about August 21st, the Department of Developmental Services formally sent emergency regulations to the Office of Administrative Law to guide alternative service delivery. And that would have allowed, after public comment, for regulations to go into effect that would allow for the end to absence billing during a state of emergency and the introduction of this new model. Before there was a chance for the public comment period to end, the governor issued an executive order, and that was last Monday. And that order suspends absence payments that would otherwise be made in connection with states of emergencies in response to COVID-19. It doesn't change anything about other states of emergencies, including things like wildfires that some areas are experiencing right now. It directs DDS to develop and implement policies to allow the delivery of non-residential services. And it doesn't require that things go through a regulatory process. And it allows for flexibility for the department to issue statewide standardized forms and to make modifications as things change. And the DDS has let us know that they are going to issue directives today at some point, and they will be taking the input that people submitted in response to the emergency regulations that were published as part of their input on the directive they're going to issue. What are the types of alternative services people will be able to receive under this new model? It will include supports related to minimizing exposure to COVID, completions of individual assessments, completions of individualized service plans, services delivered via telephone, video, or other electronic communication, delivery of meaningful supplies or other items to the consumer's home, use of self-guided training and educational materials supplied by the provider to support the service, skill training to individuals who live in someone's household to support a consumer. It can include services provided in person that are modified to comply with the most restrictive state or local guidelines in effect, training to vendor staff, supports for transition to self-determination, and most likely other things as well. From an individual served point of view, from September 1st, consumers are going to have to engage in electing to receive alternative services and work with the service provider and regional center to really engage in discussions about the service options. The individual program plan will continue to drive the implementation of needed services and supports. And alternative services should be provided, and then consumers will be able to provide feedback, and services should be adapted as needed. New services and new providers can be identified during this time to meet individualized needs. From a provider view, DDS is working with Department of Healthcare Services and Centers for Medicare and Medi-Cal to approve this additional flexibility. Our non-residential service providers will have to certify which alternative services can be delivered to some or all participants. DDS is going to calculate a monthly rate for each provider, and providers are going to have to submit a certification about what services they will provide to the regional center, as well as reimbursement claims. And they will also need to submit monthly reports. And there is going to be technical training on claiming and reporting for service providers. And there will be a requirement that oversight of consumer services and documentation of that is maintained. Now, DDS is in the process, from feedback about the emergency regulations, of considering different options for provider accountability. There will be a requirement that an individual service plan will be developed for each consumer within a specified time period that's person-centered and that's a collaborative approach where appropriate. And that will be different from, for example, if someone attended a site-based day program, it'll be different from what the service plan was when everyone was on site. It will require reporting of staff retention and that providers have maintained staff. It will require notification from regional centers to self-advocates and other family members about this service delivery alternative. And it's expected to establish a minimum amount of service to be provided to each consumer per month. So a lot of questions have come up about as to whether an alternative service delivery model will have to be used, or is there no change to the service model? And for people providing services the same as before COVID, for example, people providing supported living services where people are getting actual direct supports right now, there is no change to the service model. For people who are exclusively providing services through remote technology or alternative locations, such as providing some sort of counseling that takes place completely via Zoom, or alternative locations, people providing services in an outdoor location using masks, those providers will bill the same way. No change to the service model. However, if services are provided from the alternative service options that are different, and they may also provide some remote service options similar to how they did before, or any combination of those things, they will be on the alternative service delivery model. So I'm sharing with you here some of the things that we're expecting to see from the Department of Developmental Services. The third one there is the directive, and we expect to see that today. And we expect to see more work group meetings and town hall briefings. DDS has been conducting those this week. They're actually conducting one right now. And we expect to see more engagement and taking feedback on people's concerns. We expect them to issue some frequently asked question guides, and we expect a rollout of a family member and self-advocate engagement guide. We expect them to be working on procedures and training for regional centers, as well as technical assistance with our computer software that actually sets up authorizations and pays bills. And so people expect that in September, there will be webinars to share innovative approaches to service delivery and to inspire different options for these models. And there also will be a technical assistance and training agent to work with service providers on how to do this. And we know that across the state, and especially in our region, there have been multiple examples of great development of alternative service delivery. And so I expect some people from our area will be asked to participate in some of the technical assistance. And then just a little share about the kinds of things that are coming from different stakeholder groups. Questions about interpretations of how monthly rates will be calculated, how to measure consumer outcomes and satisfaction, how do non-residential services use this model to support residential services and families. There's going to be questions about the rate and different rate adjustments that have taken place recently. And we're hearing a lot of questions about accountability for people receiving payment, consistency with statewide implementation so that there are similar ways things are being implemented in every region of the state, focusing on training for underserved communities. A lot of questions about how individuals with higher intensity support needs will be supported and how we can use participant-directed services as alternatives. And so I'm going to go to chat, and I'm going to ask you to share questions you have in our chat, and Steve Robinson and myself will work on answering those questions to the best of our ability. What I will say is that at this point in time, what is going on is we are getting a lot of new information every day, and how we see things going forward may change. And sometimes that's hard to not have certainty about what these models will look like. But I think what we are expecting is really a robust opportunity to be creative and to also start to consider how people can be best served as we move forward. And we may be able at some point to start to really consider how people can get more direct services, what will be safe, what will allow people to be supported in a way that won't transmit COVID-19, and yet people can get their needs met. And we see some good examples in childcare settings where people are able to have consistent cohorts for a period of time, and that's considered fairly safe for those who are healthy. And so all of those things will be part of the conversation as we move forward. And so I'm welcoming questions, and anything we don't have the answer to is something we'll be thinking about moving forward. So the first question I have here is, are service providers allowed to offer services in an outdoor setting in small groups? And so I think the important thing about that is that service providers will be required to follow the guidance, the strictest guidance of both the state and local county health departments. Right now, if it was a stable group and individuals were outside and wearing masks, that might be something that could be provided in small groups. There would be an interest in the small groups staying consistent from day to day. Okay, and the next question is, how are people who are unable to benefit from electronic means supposed to take advantage of these services? And I think that's really going to be the conversation moving forward. Until this point, the conversation has been what has the program or whoever is providing services been able to do. But now it's really going to require that there be a conversation that includes the individual served, the regional center, and a service provider to figure out what's right for that person. And that may include looking at something like participant-directed services, or looking at whether someone might really need much more personal assistance and direct services with a consistent aid every day or something like that. Steve, do you have anything to add to that, or?
No, I think that you covered it.
Yeah. So the next question is, my niece lives in a group home and I'm her conservator. How will the regional center contact me about her day program's proposed service alternative, and received a packet for September? The day program should be reaching out to have a conversation about what would work for your niece and what would be what you wanted in terms of those services. And it really will be dependent on those things. For some people, they will be getting supports in their group home to participate in Zoom meetings while they're not able to go to a group site. And for others, it may be doing some small amounts of outings and one-to-one support with consistent staff as we see a little more stabilization of COVID rates. We'd like to see that people can work together who are working with individuals in a group home, with the group home, so that we can all develop services that are really what people want. I did say there's a question about DDS. I've been told, and I'm going to believe, that we will get a directive from DDS today. Sometimes those come out late on a Friday evening, and so it may be then. DDS will not have the rates for each service provider that are monthly rates today. They will be really working on that in the months of September, and it will be a process for them to get those in place. What is true is that if a provider in September is serving someone, they will be able to bill in September. If they are not providing services, they will not be able to bill for that consumer in September. And that's all non-residential providers.
And if I can just add one thing.
Yeah.
Most likely providers will be able to bill as you have been for alternative services, of course, for the months of September and October. It's going to take DDS some time to figure out the monthly rates per provider all across the state.
So the next question is, has there been any information on what needs to be done when a person doesn't want to receive any remote services? At this point, if there is someone who remote services and any of the alternative service delivery models from a particular provider or from any provider don't seem to be working, that is a time when there should be an IDT decision and meeting, and there should be discussion about what what would be wanted and what would help someone meet their goals and live the kind of life they want. Would it be some other types of services we hadn't considered before? So it would take a meeting, and that is why some of these services and exactly what's going to happen is going to take a little while to get in place. But it will be conversations, and that is certainly someone's choice not to take remote services. And it's a similar answer to the question about people who aren't able to access electronic communication. I think we really have to visit how people who can't be served in a lot of the alternatives that have been provided can be served in the future. Steve, maybe you can talk about this. We have transportation contracts. Are there provisions for our opportunities for alternative uses for our vehicles and bus drivers?
So right now we're being told that there will be opportunity for alternative services for transportation. And it does not necessarily mean that you need to be using a vehicle for these alternative services. We're waiting for more clear directives in that regard, but DDS has been stating that alternative services will be available for transportation. We just need to see what that will look like.
So that might be something like delivering materials, but it also might be providing some alternative support to individuals, maybe even driving to appointments or connecting with people in different ways when it's people who've had relationships with consumers. So we are waiting on that. I think that the idea is that we really need to maintain some of the infrastructure that's useful, and we want to continue as we move forward and get out of the pandemic. The next question is, my son needs support to participate in Zoom activities. I am unable to support him all day. What options are there? See if you want to take that.
That's not an easy one, and I think it needs to be discussed with the ID team. Understand at home all day who may not be able to use technology and getting on Zoom by him or herself. So
we are providing daycare as we would for parents who are working. We're also considering what additional supports individuals need. We understand that while some parents are working from home, they are still working, and while often we haven't considered daycare or childcare in those circumstances, this is a very different time, and so we are looking at those additional supports as well. So Cindy is sharing a comment about, we've recently engaged a new admission to our virtual day program. The case manager mentioned that the service code will be different than our current service code. Will this reflect the new rate? At this point, we actually, our case managers are learning this process along with us. And so we're not expecting it to be a different service code than what the day program has. There may be a different rate, but we're not expecting a different service code. We have created some additional service codes for new or different services during COVID, but we're not expecting that to differ. Steve, do you agree?
I agree.
Yeah.
Right
okay.
now, there will not be a separate service code for alternative services.
Yeah. If a person doesn't have internet access, who covers that cost? This is a really good question, and it's something that's being talked about a lot at the state level, and we are hoping that we will have the opportunity to support people with technology and as well as with Wi-Fi access, and we expect that if that is true, it will be based on some sort of income standard, a percentage of poverty or something like that, which is the basis of a lot of other programs we have in place like that. However, we have talked to a number of day program providers who have helped people with access to technology, and that may be something that different program providers also support as part of their overall service delivery. But going forward, we do expect there to be some ways that we can support internet access and digital technology. Do we have specific protocols to follow if a person in a small group has tested positive? Right now, we are calling on providers who have someone in a group who tests positive to work with both us and our clinical staff, as well as local public health departments. Usually those sorts of things involve the public health department because people need to get tested, and then those who've been in contact need to be tested. Our experience has been that we have a fairly low rate compared to statewide rates of COVID infection in our area. A lot of the infection comes through staff working in different settings and those sorts of things. So there are ways we are tracking and helping to identify what happens. However, when a small group that's been working together, for instance, 3 people working at a grocery store in a small group with a coach, I would expect that whole group, if one tested positive, would be expected to isolate until their status was known and until the time for infection would disagree. For day programs, does Zoom meetings, emails, and phone check-ins qualify for no changes in billing? Steve?
Yes, I believe that is the case. We will receive DDS directives hopefully today, but that is our understanding, that it would qualify for alternative services
and a monthly
and thus
rate.
qualify for billing.
Yeah. Where can families find an aide to provide supports for Zoom activities? That's a good question. And that might be working with your ID team, and as we move into the new service delivery alternatives, working with who's providing the Zoom activities over having a stable staff and an aide in the home. They may have staff. So that's something I think that for people who really need assistance with those activities is what some of that discussion moving forward is going to have to be. Here's a question: can we provide in-person services in a 2-person cohort with social distancing for an individual who won't wear a mask, but staff wear a mask and are able to maintain social distance from community members? So that's a good question, and that's a question that I would raise with the public health department. I think that one of the things that we've been encouraging, and I would say for any programs and homes and anyone offering services, it's first trying to work with people on wearing a mask and desensitizing to wearing a mask. We have also have the ability to provide face shields for people. And for some people, the face shield, while it's not the optimal thing to use, would be a good approach. So those are things that the ID team will have to discuss, and we will raise those questions with public health as we move forward. The next question is, what is being done to assure that day programs for special needs adults are able to be funded during this time? Any day service that wants to develop alternative services during this time. They may be via Zoom, they may be via educating the direct workers for individuals, they may be via actually using some staff from the day program to support a person living at home with their families. The problem with transmission of this virus is that we really want to have people in small groups. We want to follow public health guidance, but there are many situations right now where people are getting direct service. Staff are wearing masks, staff are using protective equipment. So we do anticipate that there are ways that people can develop alternative services. Question, do you anticipate that some day programs will have to close due to the ongoing shutdown? Steve?
We really hope not. And I think part of the purpose of alternative services and continuing funding is so that day programs can continue to get paid, but also to keep their workforce, so that when programs do open in the future, individuals have something to come back to. So in order to retain or preserve the workforce and keep alternative services and day programs afloat, there is this ability to fund them ongoing during this pandemic.
And I think the other thing is that while we want to have infrastructure in place for when the pandemic is over, I think we're learning a lot about what works for people, and we may see some things that are very different after the pandemic. We may see people saying, well, I do want to go and connect with people 3 days a week, but 2 days a week I'd like to stay home and do Zoom classes or do things locally. There may be differences, and I think that part of this period of time is really being open to flexibility and change and being willing to see that those things may be different in the future. Someone is asking about using a caregiver to watch my kids at home. I'm not comfortable hiring someone I don't know. I would suggest that you think about participant-directed services and talk to your case manager about that. We are supporting people who need to hire a caregiver because they're out doing essential work or they're working from home, and there are a number of different ways that can be done. Who will be responsible to make sure everyone is accountable for the number of hours they are billing and not just making a call now and then to bill for a full day of service? So I will address that question, and maybe Steve has something to add. During absence billing, providers have been allowed to bill regardless of whether any services were provided. As we move forward, providers will be billing a monthly rate, which will require that services are provided according to an individual service plan, which is what you, your ID team needs to talk about and develop and agree to. And there will most likely, and we don't know what the minimum is going to be, in order for someone to provide services, they're going to have to provide some minimum. We don't know what that will be, but we do expect that will be in place. And it will be a collaborative effort to monitor what's being done and what's being provided between the program, yourself, and the case manager and others at RCB. My son's adult program is ending in September. How will his needs be met with a new program or individual program? Steve, do you want to address entering new programs at this point?
Sure. Yeah, there is a program closing the end of September. And at this point, the case manager hopefully is offering other options. We do have day programs that are providing alternative services and have been even prior to September 1st. So the recommendation would be to follow up on referrals from your case manager to speak with these other day programs and see which one would be a good fit.
And I think we have a number of day programs that have already taken on new individuals during this period of time and are very open to doing that. Amy asks, can RCB provide aids to help clients participate in Zoom activities if parents are working all day? Yes, that's considered childcare. And that is definitely something, or daycare, what we can do. And similar to the next question about families are being told respite and childcare will not be provided during school hours. That's something we're looking at on an individual basis. However, we know that many families are working and not able to support their children all day. So unlike what is typically how we look at these situations, we are looking at how to support people through the pandemic, which, although a lot of children are able to do a lot of Zoom activities independently, many of the children that we serve are not and need additional support. And we will consider providing those services as well. Respite is a service that is generally would be provided outside of school hours, so we would look at that as childcare. But this is a place where we are more expansive in how we would do things typically. But as you also may know, there are possibilities for some children who need to attend school. Children with IEPs, school districts are expected to serve children who are not benefiting from remote education if that is the preference of their children. Their families. Is childcare part of the alternative service delivery? So the same question about during distance learning hours. We expect that we are expected to support individuals during those hours when it is a situation that the parent is unable to do that because of their work responsibilities, similar to any way we do childcare. And there may be other exceptions to that as well, because we do know there are families who are supporting several children at the same time doing remote learning, and some of the children who have additional needs also need to be supported. Our understanding, though, of some of the school district things are that some school districts will be able to support aids to support children in their learning, but that's not going to happen tomorrow, and this will be a process, so we will work with you on that. So we've been doing a lot of short-term authorizations of service because there's been so many unknowns. So if you continue to have a need past August, please talk with your case manager so that we can move forward and support you. We do not expect to abruptly cut off any services when there's a need for those services to continue. We understand the struggles that are going on right now and the needs for continued support. Is there funding for residential programs who are being served by non-residential day programs? For people who have who live in licensed residential services or who live in their own homes with supported living, since the pandemic began, we recognize that people, in addition to accessing things remotely with technology, we recognize that people also have care and supervision needs. So we've been providing additional support in residential homes, supported living, in order that people can continue to access what they need. So we will be continuing to look at those things and expect to be continuing to fund those things as we move forward. Have programs that not have been providing services to clients been receiving funds from the regional centers? Yes. The governor declared a state of emergency, and that state of emergency meant that a section of the regulations required that absence billing be allowed. And when that occurred, we were required to pay those providers. The expectation is that they were retaining staff and continuing to try to connect with people during this period of time. Starting September 1st, that will no longer occur and services will have to be provided. Let's see. So I'll answer the question about the individual who lives in a board and care home and the roommate. That would be a good question to raise with your case manager so they can look at the specifics of that and talk through that. Let's see. Who has the authority to provide an aid to the client at home? Is it the day provider or the case manager? That's a specific question because if a day program provider has staff and they are able to come into the home, that might be a possibility, but that's going to need to be discussed. And if it only is for a couple of hours a day, we will probably have some concerns about that between staff moving from home to home. We'd rather have one more consistent provider. Is there a pool of help for people participating in Zoom classes? This is where I think we're going to have to get creative with alternative service delivery. And some of the ways alternative services are delivered is going to be providing some in-person support and some not in-person support. And I think that's where we're going to have to consider where we are in the pandemic, what is safe, what is not safe. And what I will tell you is that the guidelines in our counties are that people should be maintaining small groups of people that they interact with in close proximity. And so we have asked providers of direct services such as supported living and residential programs to have staff work more consistently with one consumer and not work with 2, 3, 4 people in the same day or the same week so that people aren't spreading the virus in larger groups. And I think that is something that is going on. I know that I see, and maybe we can talk about how to develop these pools. There's a comment that's not fair to the programs that are providing services. So I think the one thing I'd say about that is if that has been your concern, that will stop starting in September. And we will work towards making sure that people are providing services. However, there are reasons why people were unable to provide services. And some people were not interested in having people in their homes. And so we hope that people will, moving forward, be able to provide services. Our case managers currently working from home or in the office. I haven't been able to get a response from my case manager. If you haven't been able to get a response from your case manager, please use our email, which is write to us at rceb.org. Michi will put that in our chat here. so you know where to contact us, and we will make sure you get contacted and responded to by your case manager. We expect people to be responding to messages within the 2 working days that we've had as our standard. If you are not getting a response from your case manager, please use our website and use the contact us button there, and you will be able to connect with us. Okay, so we have that in the chat. It's write to us at rcb.org. So for a younger child, for alternative services, if that child is at school age, this is something that you should talk with the school district about. And if it is a child care issue where you are not home during the day, you need to have childcare as well, that is something that we can do. But if it's about how to tailor education services for your child's needs, that will fall on the school district, but we will work with you on those things. We are lucky in our area that most of the school districts are implementing some distance learning for people served through the regional centers. And they are following to some degree IEPs, but it is not universal and is something that we do need to have more dialogue with those districts on. So let's see. Okay, well, if anyone has anything else in the chat, I see there's one hand raised and I don't know if that is. There is someone who wants to talk, Mei Ling, and I will allow that to unmute. Mei Ling? Did you have a question?
No.
Okay, I'll unmute it. I'll mute it again since. Okay, sorry. So there were a couple of more questions in the chat, which included what will the directives that are issued say, and will case managers begin to create new IPP plans? We're expecting that over the next 2 to 3 months that people will be working with both their service providers and their case managers to either develop new plans or at least individual service plans with non-residential providers. We expect that will be happening. And in terms of the directives today, we expect them to address the specifics around alternative service delivery, and that there will be some details like we've talked about today. And over the next few weeks, we will get more and more directives. What we do know about alternative service delivery models is they won't have the 30-day limit that a lot of the directives have had. So they will be directives that may change, but they won't have to be reissued every 30 days, as a lot of directives have. Okay, unless there's any other questions in the chat, I did want to say that, you know, this is a time where I think we're all under a lot of stress with the pandemic, and with the recent wildfires, our one avenue of getting outdoors has been a little bit contained. And I think we have a lot of work to do, but we can do that work together. And while I know there's a lot of concerns in the chat about people receiving funding when they weren't providing services, and those kind of things, the intent is to have a system that is available to provide services. And the expectation in the next few months is to really creatively envision what we want and what each person can get, and have more of a conversation about what is being provided, which we would normally do through the IPP process. And I know that sounds a little Pollyanna-ish as we are dealing with things, but we really can work together and really maybe develop some things together that are even more than we had before. And it's an opportunity, and hopefully we'll be able to get together and be together in 6 months, 8 months, once there is a vaccination available and we are not seeing the community spread. So thanks for joining us today. We'll have another webinar in 2 weeks, and I'd love to get any comments from you through Write to Us, and we'll think about any webinars you'd like to hear. There is one more question at the end about can I get a list of services? And services, there's a list of services that regional centers provide on our website. You can also find that on the DDS website. So thank you. Bye-bye.